Here's a USMLE style question focused on the posterior descending artery. Question on posterior descending artery. Here's a clinical scenario for you. A 64-year-old woman presents to the emergency department with acute onset chest pain and lightheadedness. The pain radiates to her back and is associated with nausea. Her ECG shows ST segment elevation in leads 2, 3, and AVF, as well as reciprocal ST depression in leads 1 and AVL. Cardiac catheterization reveals an occlusion in the artery supplying the posterior interventricular septum. Question: in a right dominant coronary circulation, which artery is most likely occluded in this patient? Option A, the left anterior descending LAD artery. Option B, the left circumflex LCX artery. Option C, the right coronary artery RCA. Option D, the obtuse marginal artery. Option E, the diagonal artery. The correct answer is option C, the right coronary artery RCA. Explanation: the posterior descending artery, PDA, supplies the posterior interventricular septum, the inferior wall of the heart, and parts of the posteromedial papillary muscle. In a right dominant circulation, which occurs in approximately 85% of people, the PDA arises from the right coronary artery, RCA. Inferior wall myocardial infarctions, as indicated by ST segment elevation in leads 2, 3, and AVF, are commonly associated with RCA occlusion. In left dominant circulation, the PDA arises from the left circumflex LCX artery, but this is less common, 15% of cases. The LAD and diagonal arteries are unrelated to the posterior interventricular septum. Thank you for listening, and keep pushing forward in your USMLE preparation.